Hi all, welcome to OET Speaking and Writing. Today we can discuss an OET roleplay. Here the setting is a suburban clinic and the patient was recently involved in a car accident and suffered concussion. Task: get details of the current problem. Patient seems to have seizure at work. Listen with empathy and pacify the patient. Discuss the possible cause of seizure, brain damage, the test required EEG and the range of treatments available, that is medication. From this background information, we can understand that you are a clinic nurse and you are talking to a patient who is recently involved in a car accident and suffered concussion. And as per the task, we need to collect the history about the current problem and listen to the patient and empathize with the patient, then discuss cause of seizure and explain about the test to diagnose the seizure and explain about the importance of taking treatment, that is medication. This is the scenario. Here this setting is a suburban clinic, so the patient is unknown to you. So you don't need to ask the name of patient during our preparation time. So you can start the conversation by saying good morning. Probably the patient might greet you. Then you can say like, my name is Sarah. I am a registered nurse working in this suburban clinic. After that you can ask, how may I address you? Then the patient will tell his or her name. Here let's assume the name is Mr. John. Then you can ask question like, how may I help you? Probably as per the interlocutor's card he may reply like, Sister, I fell down yesterday, but I don't remember much. At that time, we can assure him by saying, Mr. John, I am so sorry to hear that you had a fall. Try not to be worried. I am here to help you. After that, you can ask some more details about his fall. So you can ask question like, could you tell me more details about your problem? At that time, patient may reply like, Sister, my friends told me I fell down and my eyes were rolling. They said I had a fit, but I cannot remember anything. In that situation, as per our first task, we can say like, okay, Mr. John, from your explanation, I understand that you had a seizure episode. Probably at that time, the patient might be scared. Then we can reassure him by saying, Mr. John, I do really understand your situation. Please do not get tensed. It's not a serious condition. Again, the patient may be anxious and will tell like, how can I have seizure, sister? At that time, as per our second task, we need to pacify and listen with empathy and explain about seizure and its cause. So you can say like, I understand it might be difficult for you. I will make all arrangements for the treatment. So you don't need to worry about that. Then we can explain about seizure and its cause. Before that, you can ask question like, do you know anything about seizure? Or you can ask, are you aware about seizure? Probably the patient may say like, Sister, I don't know much regarding seizure. At that time, we can tell him like, Mr. John, there are some electrochemical activities in our brain. Seizure is a condition in which these activities are disrupted and it may be due to head injury or trauma to head. Is that clear? Then we need to collect the history of patient. So you can ask question like, have you met with any accident before? Then as per the interlocutor's card, he may tell you like, Sister, I had a car accident recently. Now I remember that. At that time we can say like, okay, Mr. John, this may be the reason behind this episode. You don't worry about that. There are some tests available to confirm the diagnosis. Can I explain to you? Now, as per our third task, we can explain about EEG. So you can say like, Mr. John, the test is known as EEG, electroencephalogram. It's a simple procedure in which we will place some electrodes in your head so that we can record the electrical activities of your brain cells. And it's not a painful procedure. Am I clear to you? Probably at that time the patient may deny the fact that he could possibly have a seizure. In that situation we can tell him like, Mr. John, it's a manageable condition. Once you are diagnosed by the test, the doctor will prescribe medication so we can effectively manage your condition. Is that clear? After that we can ask permission for EEG procedure. You can ask like, are you ready for the procedure? Sometimes patient may agree with you, sometimes he may deny the fact and deny the procedure. In that situation, we need to reassure him. So you can tell like, I assure you that if you do this procedure, we can diagnose and treat accordingly so that you will get well soon. Is that okay? Is that clear? Are you willing to do this procedure? You know, Mr. John, if you follow our instructions, we can treat your condition and you will be able to lead a normal life and you won't suffer or you won't experience any seizure episode in the future. Am I clear to you? Then you can tell him like, you know, Mr. John, it's a simple procedure only. I'll be with you during the procedure, so you won't need to be worried about the procedure. At last, the patient may agree with the procedure. Then we can wind up by saying, do you have any other concerns? Or you can ask, is there anything else I can help you? If there is no other concerns, you can say like, I hope I have cleared all your concerns. Thank you for listening to me. If you need any more help after going home, you can contact me at any time. This is my number. I am happy to help you. Then you can say like, now I am going to do the arrangements for the procedure. Please wait here. I will come back soon. Okay. Thank you, Mr. John. Get well soon. In this way, you can end up your role play. Thank you.